helping to make your life easier. Local every day.
Maybe you have a food allergy. Help is available for you. Dr. Rob Shaleski with Allergy, Asthma and Immunology Associates is here to explain. Nice to have you here today, Doctor.
Yeah, thanks for having me.
So Xolair, what is that exactly?
So what that medication is it's what we call a biologic therapy, and it targets the specific allergy antibodies floating around in our blood if we have allergies to things.
Okay, and this is for food allergies or a lot of other different issues?
It's actually been around for over 20 years, and it's been approved for things like chronic hives and bad asthma, but it recently got approval in February for helping with food allergies.
How did we find out that it was working for that?
So there's a big clinical trial that went on, and a lot of people participated in that, and they showed that with the patients that were on Xolair, they were able to tolerate a lot more of the culprit foods that were causing reactions for them.
Okay, let's talk about that because it's helping patients with a food allergy. What kind of food allergies are we talking about?
We're talking about severe, potentially life-threatening food allergies to things like peanut or milk or wheat, tree nuts, those types of things.
And people can get this accidentally, can't they?
Yep, absolutely. Accidental exposure happens a lot, even if you're very, very vigilant about it. And so what Xolair will do is it provides that kind of extra layer of support where if you were to have an accidental exposure, the odds are less likely that you will have a severe reaction from it.
Wow, so you have to have that on hand and take it immediately.
So Xolair is actually dosed either every 2 weeks or every 4 weeks, and it kind of depends on your body weight and how many allergy antibodies you have in your blood.
Oh, okay. And how would someone know if they have a food allergy to begin with?
When we diagnose food allergy, we look at the clinical history, what kind of symptoms or signs that they have, whether it's hives or troubles breathing or vomiting, loose stools, and then we actually do testing, whether that's through a scratch test on the skin or a blood test to determine if they have those allergy antibodies.
Okay, and so they would take Xolair, like you said, every couple of weeks, and this is kind of as a preventative?
Yep, it will really help. It doesn't replace food avoidance because the main goal is to continue to avoid those foods that you're allergic to. But in the event that you have an accidental exposure, it will really help reduce the risk that that exposure is going to cause a severe or potentially life-threatening reaction.
Okay, and if you do have a reaction, get to a doctor immediately, right?
Absolutely.
Okay. Doctor, thanks so much for coming in today.
Yeah, thank you for having me.
And for more information on Allergy, Asthma and Immunology Associates, go to 1011now.com.